Thanks for tuning in. Mental health. It's something we all navigate, but often don't talk about enough. From stress and anxiety to self care and mindfulness, we're diving into it all today. So, joining us is Dr. Kubiat Nduonofit, a registrar at the University of Uyo Teaching Hospitals Mental Health Department. She's here to share her expertise and insights and help us get real about what's on our mind. So let's explore ways to prioritize our well-being together. Dr. Kumbi, I can call you that. Kubi, yeah, I can call you that, right?
Yes.
You're welcome
Thank
to the
you.
show.
Thank you so much. Hi, viewers.
You know, whenever we have ladies in this department, we always want to know what's the secret? What's the flair? Why mental health department? I mean,
I know
why?
it's quite odd, yeah. Okay. I mean, for me, it wasn't always the first decision.
Oh, really?
Right through medical school, you have the common options, community medicine, and the other specialties. But COVID struck, and then I had this feeling that I could use my primaries at the time, which I was preparing for.
Okay.
Incidentally, I did my National Youth Service, the core NYSC at Behavioral Medical Center in Abuja.
Okay.
And yeah, I passed, and that was my gateway into psychiatry.
Really?
Yeah.
And how has it been? Any regrets?
No, not
really?
at all. No, not at all.
You've never been, you know, I don't know whether it's a myth, but we have this thinking that someday one of you could be attacked by, you know, some of these mentally ill persons. Do you have any of such experience?
Of course, we have patients who are ill, and you know the usual fear is expected, but there are systems in place to curb all those issues. Yeah.
Okay, I'm glad there are systems in place. Yeah. Okay, so now let's dive into our discussion proper. So mental health, you know, I think it's misconceptions around mental health. Are there any of them you would want to debunk today?
That is a very interesting question. And to be honest, it's a broad one, because the usual stigma is that anybody behaving unusually or not in the way that they are used to is labeled or termed as, you know, mad. We don't use those lingo anymore, even describing people as lunatics. But I would like us to start with the definition of mental health. What is this mental health that we so commonly, you know, use? It is basically a state of wellness, a state of well-being, where an individual realizes his or her own abilities. He's able to cope with the normal stresses of life, and can be productive and fruitful, and also is able to be productive even in the community he or she is placed at. Yeah, that's what mental health is all about. So when there is an imbalance in this, there can be distress when, you know, the individual cannot cope with the normal stress of life. Yeah, so that's where we have mental illnesses, but they usually start as distress, and then if not checked, they can progress to something more serious or severe.
Okay.
Yeah.
And then, can you just give us some common, you know, mental health challenges people usually have?
Yes, in our environment, of course, you know, we are in Africa. The issue with poverty, the economical state of the nation, and so many other issues, you know, work stress, work imbalance, and all that, poor remunerations. You can have people suffering from stress, you know, which can culminate into some psychological disorders or distresses and the likes. Yeah, so when it becomes serious, you can have people having changes in their mood, very common, where we have people say, I'm depressed. But for depression, you would have to be diagnosed clinically to be termed depressed. But you know, now in our everyday modern parlance, everybody tries to be in term or use the word our psychological terms, you know, so casually. But yeah, in the loose sense of the word, depression, or when I say I'm depressed, it means being sad. However, if it continues for a certain period of time, let's say 3 to 6 months, I mean, that's no longer just being sad, because there are things we look out for when this person comes to the clinic. So yeah, depression. We have other mood disorders like bipolar disorders, where there's, like bipolar, as the name implies, there's a swing between moods. On a day, person can be on a high, and another day the person can be on a low, right? So that would also manifest in their behaviors, you know, some unusually energetic states. And, you know, it's quite interesting to see. Yeah. And then sometimes aggression. Yeah, unexplained aggression, irritability due to stress. And especially when one is continuously exposed to these issues and they are not addressed. When they are not addressed, then it becomes, you don't know the day that you would blow out, and you know, that becomes a major problem. Yeah.
Esther, you want to
that is just one of the many. Depression, bipolar.
Well, while she was speaking, you made mention of bipolar. Now, I have witnessed one or two persons who, it was a term I just heard, by the way, but then I have witnessed one or two persons who exhibited such symptoms. So as a layman, is not a psychiatrist, how do we identify people with mental health illnesses? Not just people who display maybe strong emotions like emotional outburst, anger, you know, at every point in time. How do we differentiate between one who has this illness in them and one who it's just a temperamental shortcoming?
Well, as a layman, it may be confusing, to be honest. It may be quite confusing, but one of the approaches we try to look out for, especially when our patients come to us, is the duration. So most of these, like I said, mood disorders, it's okay. Every human being is allowed to have different mood swings. It's totally normal. The brain is regulated by neurochemicals, which regulate our moods. When they are down, you know, it will reflect in the mood. When it's high, it will reflect in the mood. And by that, I'm referring to our endorphins. For those that work out a lot, we get that high when we work out, a burst of energy. So when you have these unusually exaggerated symptoms in the mood over a continuous period of time, it's 1 week, 2 weeks, I mean, it's okay. But when it's not addressed, it will progress. And if a layman notices and is very mentally aware, he or she will be able to pick it and draw the attention of
I love that
their
word.
loved ones.
I love that word, mentally aware. In cases of a couple, like she made mention in the opening. Yes, about the lady who set the spouse ablaze on grounds of infidelity. Maybe they've lived together for a long time, and then he had noticed these emotional swings, extreme swings. So how should a couple, people living together, or maybe a parent who has a child with this, how do they manage the spouse or the child or colleague in the office?
I had to sigh because I know we are still struggling in that regard. A lot of awareness has been ongoing, but it's still not enough. There is a gap, to be honest. There is really a gap, because, you know, our environments were plagued with a lot of, you know, biases, religious biases, cultural biases. So we need more people to be interested about mental health, so that it's not just about sounding cool and knowing the terms, but knowing how to identify what is abnormal, what is not, you know, an uncanny state, really. So if you notice something that is odd, it's okay to refer to a hospital, and that's where we the experts are.
You know, I keep wondering, like, over the years, in your own opinion, how do you think the society, you know, our approach towards mental health, how much do you think we've changed over the years?
Oh, that's a very interesting question because I know Nigeria, well, let me narrow it down to Akwa Ibom State.
Okay.
We are trying, but we can do better. You know, the demographics, the whole reports for how we are perceived, you know, when we have or we come across individuals that may be struggling is tricky, in the sense that when someone may know that there is a problem, may identify, may even be assertive enough to know that something is wrong in terms of their mood, the way they feel, they're not okay with some ways, or maybe they have even been reported to by concerned friends. But you know, that fear of how they'll be perceived, fear of being judged, you know, even the cultural beliefs that we have, they can even be perceived as being a failure. How can you be depressed? How can you say that about yourself, you know? So, I mean, we still have a long way to go. We, at the clinics, you know, it's typical to see our patients after they must have gone through the rounds, like maybe they will go through the units, the different units, and until someone maybe identifies it, especially our other colleagues in different specialties, they will refer them to us. So we are trying our best as much as possible to use this opportunity, especially as World Mental Health Day is just around the corner, to create more awareness around this mental health of a thing, and just let people know that it's not wrong if you discuss with someone that is trusted. It's okay to even want to find out if this is normal. If it is, fine, you will recover. If it's not, then you can get intervention. So there is no need, in my opinion, there is no need to be, you know, to be modeled up by what the people would perceive of you or blame yourself, because that's always the cycle, you know, and I think we can do better. So yes, please, let us encourage conversations around mental health. And
absolutely.
if you have experienced any mental illness, been diagnosed and have recovered, please be a leader. Lead by example.
Champion.
Tell people about your experience and show them how you got help. You know, show them, encourage them to seek help. You know, it's very, very important.
I think this is a very difficult task you've just mentioned now, but are there things put in place by your department, you know, to help, you know, achieve this suggestion you just made? Because I wanted to even know, do people just come into your department to say, okay, I have a mental illness, there's something wrong with me?
Yes, you'll be surprised at the cases that come. Yes.
As they come by themselves?
Yes. Yes.
Okay, so when they come, as in, how do they express themselves, like, this is what is wrong with me?
You know, that is the beauty of psychiatry or mental health. You know, we are trained to do what we do, and we have a systematic approach, and we do not work in isolation. There is a multidisciplinary approach in place. So right from when the nurses interact with the patient, the record staff, the nurses, the social workers, and then by the time they eventually come to the consulting room to meet the doctor, you know, it's easy to communicate with them because we are trained to identify mood complaints or whatever psychological distress this person is going through. Interestingly, the most common, or should I say, depression, when intervened early enough, especially at the early stages, it can be addressed with therapy, you know, by the clinical psychologist, interacting with this individual and giving them tools on how to cope, you know, and they do not need medications. However, it is when these issues have gone on panned for a long time without intervention, and it even becomes severe with manifestation of different unusual behaviors and, you know, believes even that you now need to medicate. So we don't just, we understand our patients when they come, and it's not wrong to be perceived as mentally ill. You've been subjected to stress, and your body is just telling you all is not going well, slow down. The brain is an organ. It controls, let's say, everything, your thinking, your execution. You will not function, you will not be productive if you're not at your optimum.
You know, I'm still wondering, you know, how to answer that question, because every human being, we think what we do is the best. We think what we do, it's okay, except someone comes in and tells me, babe, this thing what you do, it's off. All right. So I keep wondering how humans or how patients at this point now we just walk into the facility and say something is wrong with me. You know, how are they able to identify? That, you know, you mentioned if you have a prolonged depression,
sadness,
I can understand that. But we also have other branches of this mental illness. So when they come in, I really want to know, did they just sit down and say there's something wrong with my...
No. Most times they will not even come and say this is what is, or there's something wrong with me.
Okay.
We have a series of questions that we ask.
Okay, so in this process, you get to find out.
Yes, that is how we find out. We collect the patients.
Okay.
We ask, based on their complaints, how it started, when it started, you know, for how long. We try to, you know, like go back in time to see where the origin, to try to establish, you know, it's a skill.
It's
really.
a skill, I understand. So I understand.
So yeah, we really interact, and our conversations are long. By the time we are done interacting with the patients or with these individuals that come in, we would have had some. We would make significant progress. Sometimes even realizing that it may just, you know, have been due to the stressors, the circumstances that this person or individual was exposed to that must have led to. So it's a very holistic approach.
Okay. And so that will now decide the kind of treatment approach, the diagnosis. Okay.
Exactly. And like I said, and to emphasize that we don't do anything in isolation. So when one person is done, we discuss as a team.
Okay.
Yes, because we are seeing the individual as a whole and as an extension of his or her community.
Okay.
So even the family members, and it's very good when we have good social support. And I mean, we as Africans, we have that going on, but when we are mentally aware and you combine that with good social support, it's going to be magical, if I should say so. Yeah.
All right, Esther.
Okay, so two things here. Talking about support, services, psychiatric services, very expensive or affordable?
Right now in Akwa Ibom State, I think it's affordable.
Yeah, I asked that because one of the reasons why some persons may not want to approach a professional could be the cost implication.
Oh yes, well, based on the strata that these individuals belong to, you know, I mean, not all fingers are equal. So maybe I should take that back by saying it's affordable, because we see people that actually struggle to procure even the medications.
Wow.
Yes, so, and it is important for a call to the government to also include mental health services as to be accessible to individuals. I know that a lot is going on in terms of insurance. So when mental health services are incorporated to these insurance packages, it will do a lot of good, a whole world of good for these individuals who are less privileged, you know, financially.
That's great. That's great, because I see a lot of organizations have their staff covered.
Yeah, those are private.
Yeah. But these aspects, there's no provision for it as well.
Yes, some of our patients who are under the insurance scheme or have been registered, they benefit from, you know, subsidized medications and all. Yeah, but even for outpatients that walk into the hospital, even without any insurance package, I feel that the seriousness or the severity of the the illness or the experience, whatever they are going through, propels them to procure these services regardless.
Okay, so from your experience, have you had situations where you had a patient who walked in, was obviously ill mentally, but could not be diagnosed correctly, wasn't pinned to a particular thing, and you made mention of beliefs, and maybe you had exhausted all the medical options, but there was really nothing, right? Are there scenarios like that? Have you had any such experience?
Perhaps you should go straight to the point. To ask if there's spiritual
undertone to it. And then what did you do, or what is really done?
Okay, so yeah, I mean, psychiatry is a continuum. We have psychiatry and spirituality.
Oh,
yes, these things overlap really, or they are closely related together. But in mental health or psychiatry, as the case may be, we have an international classification of diseases. There is nothing under that holy grail of ours that you won't diagnose.
Really?
Yeah, you would see them. Even for the current version which we use, it's mind blowing what the researchers have put down there. You know, so to the thing you cannot even classify, you know, there's a group for it.
Wow.
Yeah, so all that is for us, the experts. Please come to the hospital.
And then you've done all of that, the patient isn't responding to treatment. Is that where spirituality comes in?
Of course, like I said, we do not manage all these cases alone. So when we suspect that there may be a spiritual component to the illness, we have our faith-based organizations. Yes, so we don't do anything alone. Yeah, we have faith-based organizations that can be invited to come through.
All right. Yeah. I'm quite surprised hearing a doctor mention spirituality. That's a new one. All right, we'll go on a very quick break. We'll be right back to continue with the discussion. Stay with us. For being there. So we're still discussing mental health matters, and we're taking some few tweets before we come back to our doctor guest in the house. And our first tweet here says it's from Sydney, and she says, "Men's mental health matters too. Men also have insecurity, panic attacks, trauma, body image issue, eating disorders, low self-esteem, stress, depression, suicidal thoughts. They are abused." Cry, feel emotion, and need love, care, and support. Check in on your male friends. Oh, goodness. Quite touching there.
Yeah.
Then the next tweet says there is a mental health and then there is mental illness. And that's true. I think we need to differentiate those two terms. There's a difference. There is a difference. People love talking about yoga and self-care days, but get uncomfortable talking about blackouts, suicidal thoughts, manic episodes. And that's the problem. I guess when it comes to those kind of talks, people shy away from it. But that's the major problem. And then our next tweet says, maybe an unpopular opinion, but I don't think the biggest issue those with mental health problem face is stigma. I think the biggest problem is they cannot access basic mental health care in their reasonable time frame, and it's costing life. Okay, so Julius says, why mental health matters. Your brain deserves the same care as your body. Mental illness isn't always visible. Early support saves lives. Stigma stops many from seeking help. Talking openly creates changes. Okay, so that's it from our tweets.
Comments.
Very interesting. Yeah. So perhaps we should start from the differentiating mental health and mental illness, because I see Gen Zs. I was talking about it earlier this week. I said Gen Zs are so big on my mental health. Any small thing, oh, my mental health, they just quit. They don't have that patience. They're quick to solving problems, but they're also quick to quitting when it doesn't go their way. So they're big on mental health. So when we talk about mental health, mental illness, what's the difference? So we know which one when we see them.
Mental health, as I tried to define at the beginning of our session, was a state of well-being. So when there is no sense of well-being, an individual realizes that, his or her own potentials they cannot cope with the normal stresses of life. And they will not, because of this, may not be productive or fruitful in their daily activities, and is not even able to show up even in his community, wherever he or she is placed. That is what mental health is. Now, the opposite of that is what we have as mental illness. Yes.
Okay.
Yeah.
And then we see people talk about yoga, like the text said. People talk about yoga, distressing yourself. So what are those ways people, tend to relieve themselves of mental stress?
The commonest is exercise. Yes, yoga is very good because it's relaxing. It involves a lot of mindfulness. You have to pause in time, take out distractions from your mind, try to focus on one thing, and that will involve stretching, deep breathing, and that would help to auto-regulate the nervous system, because we're really controlled by our nervous system. So yeah, when anybody is stressed or feeling tense and they're able to just pause for a minute through yoga, it's very helpful. Exercise is the commonest because, yoga, a lot of people may not be so
familiar with
it, but exercise is should I say, the cheapest thing you can do, just by walking around nature. Yeah, that's very helpful because you tend to slow down, you tend to appreciate the things of life, and establishing human connections. You can put the phone down for a second, when you're at the table, you're talking to somebody, at least you can have meaningful conversations, And what else? Exercise, meaningful conversations, mindfulness and meditations, breathing exercises.
Okay.
Yeah, those are things that can help to relieve stress. Massages, yes, for the bougie ones. Yeah.
All right. Now that you've mentioned put the phone down, I'd like to know, what do you think the relationship between mental health and social media? They say back in the days when we don't have social media, there was less of these mental illnesses and mental stress. But now,
I agree.
What's your thought?
I mean, now, because our world is so dynamic, we can't necessarily discard social media. If we perceive or we see social media as a tool, it will help maybe reduce some of the issues that come along with social media and mental health. Yeah. So especially when one is already feeling distressed and, having these mood issues, going on social media may not be the best thing because that would only exaggerate or exacerbate the symptoms or the condition of that individual. So putting the phone down is very helpful because it helps you to center yourself, ground yourself, maybe like people say, touch grass. You come back to reality and know that it is normal, and it's only a phase. And you can use that period to talk to somebody, a trusted person, or seek professional help.
Okay.
Yeah.
But before Esther comes in, is it in all cases that social media exacerbates mental illness? Because sometimes now, we have this lot of comedies, skits, I mean, Nigerians are big on this. We have a whole lot of it. And then when I walk around, sometimes I see people just laughing. I see people excited. And I know it as a result of the skits they are watching on social media. So is it not time for us to rephrase that, social media and mental health? It's kind of helping to calm some people too.
Social media is very helpful, and that is why I said when we see social media as a tool, it also like a double-edged sword. It can make or mar. So when you realize the benefits of social media, you can leverage and harness these benefits. But most times, or in most occasions, you even hear people talking about a social media detox because there's a lot of overstimulation. You're seeing things from left, right, center, especially with this algorithm, that nobody really knows what they're going to see when they go on there. You're exposed to different content, and it's really worth it when you detox from social media. To be honest, it's quite therapeutic when you pause and I'm not looking at social media for a while.
Not just because
some jobs may not
allow
that.
But I tell you, it's a wonderful experience.
It is.
It is a wonderful. Esther, have you tried it? It is a wonderful experience to detox yourself from the social media.
Yes, I've tried it actually.
Initially, you think you can't survive it, but try it.
There are apps for that.
Oh.
Yeah, it can just help you focus on your task. So, before you embark on anything, on a habit, you want to, just like smoking, you can't sit down and say, I'll stop smoking and then it will work.
True.
You're lying to yourself. So you have to start with little steps. So maybe by, like there's an app on my phone that helps me focus on my tasks for a period of time. So this time I can be productive. I'm not looking at my phone. I'm not doing anything on IG or whatever, and then I will reserve that time for when I'm truly unwinding, and then I can go and have splurge.
Okay, so what does the app do for you?
It just turns off all my social media. Yeah.
Wonderful.
Wow.
Yeah.
Interesting. So, what are the commonest around this part of the globe? Commonest and mental illnesses, and then what can we as Nigerians do to be on the lookout for ourselves so that we don't become a statistic? Because anybody can become
a statistic.
Yeah.
A number.
I would say that I would say right on top of my list, as from what I see, I would say depressive illnesses are common. Yes, because I mean our economy.
I just knew you were going to say
the stress of life is too much. It's a lot, and depending on where you fall under, it's mental illness. Depression is not. It doesn't respect anybody because you can't see it, you can't touch it, and depression is the commonest. I would like to say so, yes, because it goes across both sexes, age groups. It's the commonest.
Wow.
Okay,
so what are the things we need to do to be on the lookout for ourselves? One of the tweets talked about self-care, and today self-care people are called selfish people. When you tell them self-love, they're like, you see,
self-love,
self-care, self-preservation, all those are good practices. I mean, when there is sadness, we need to establish the root cause. There's biological, psychological, there are social issues that need to be addressed. So, like I said, the biological issues, you'd try as much as possible to have a healthy diet. depending on what you can afford, really. Most of these things, you just have to narrow it down to what you can afford. So biological issues, the psychological issues, you refer to someone, talk to a trusted person, and then also learn and know that you can seek help for these things, things that you don't understand, and it can be explained better to you. And then the social issues, we can try as much as possible to create more awareness around mental health, even in our churches, even in our community, so that people would understand that this topic is not as strange as people magnify it to be. It's very close to us. It is real, and people experience these things like in everyday life.
All right, now talking about biological issues, can mental illnesses or mental health issues be transferred, like inherited from parents? Are there like history, family history, when people come for diagnosis?
Yes, certainly, yes, because we as individuals, we are made up of cells, organs, tissues, and at the very root of our cells, we have the DNA. So yes, they can be genetic. Yes, so when there is a family history of depression, any mental illness, there is a high propensity for it to occur in either the first or second generation.
Wow.
Yeah.
Okay, so Esther brought up the topic of the point of how we can support, and then I thought about it. Let's bring it down to in a home, like family members.
Okay.
Let's take, for instance, spouse. How can a spouse best support their spouse with when they have a mental health
Manic
issues?
episodes.
Well,
I know some people live in denial.
Yes. It's difficult, and it can be tricky, especially when there is a spouse who's mentally unaware. Sometimes we end up having interventions from good Samaritans, people who try, despite what the society may, be saying to intervene. Sometimes they'll even ask you, what's your business? Why are you going to choke your head inside someone's problem? Yeah. So that is that. Sometimes it's even the third parties that are most helpful, especially in cases of mentally unaware spouses. But if a spouse has the slightest inkling that something is off with his or her significant other, the best thing to do is to talk to someone you trust. Most times people, and that is what brings me back to this, having meaningful conversations with trusted people. There is always somebody, somewhere, somehow. These conversations, you don't know when someone will say something and the help will come through. So the referral will come through. Most of our referrals are informal. There's a unit in teaching hospital. There's a hospital in Eketo where you can see the doctors there. Most times, there is always help when a spouse is able to understand, empathetic towards his spouse. That's the word I was looking for. Understand, something is off about this babe or this man. Let me talk to my doctor. Sometimes you can even see a simple conversation with their own family doctor would help them, because that is where the referrals will come in. Please, there's a unit for that in the hospital.
I'm glad you mentioned conversation, because communication really matters.
Yes.
If you go about it the wrong way, you say, so you think I'm mad, right?
Exactly.
So you think I'm mad, right?
They classify madness to be when you're stripped, then you're walking on. Yes, like you're totally not.
Yeah, but then because I've heard stories, a lot of stories about couples, a little thing, the wife she has gone haywire, a little thing, she has gone haywire. We have this imagination. So the husband goes out, she's imagining, he has gone to meet another person outside. The wife goes out. We have a whole lot of them. But when you say, there could be something, so you're trying to say I'm mad or something.
Yes.
So they live in denial.
Yeah.
So when you have people like that, how best can you help them?
They're very defensive. They
Very
can be
defensive.
How
That
can you
denial it's actually quite common, I mean,
problem.
It's a tricky one.
I tell you.
It's a tricky one. But half the time, like I said, people would always want to suggest, question, okay, after you go and do the church, you pray and all that, they will be like, at least there's a hospital. You can't, there's a psychologist. And by the time they now come, sometimes they have to find some very interesting ways to come with the person in question to the department. Yes. So it's a very tricky one, but we try as much as possible to, encourage that whoever is experiencing this or is living with someone who has any form of mental distress should first of all be empathetic towards this person and understand that it is an illness or it may just be a temporary thing and can seek intervention when they come to the hospital. So even if they don't come to the psychiatrist first, when they go into the outpatient department, they will be interviewed, and from that interview, the doctor will refer them to us. So it's tricky, but I mean, when they can get to the hospital, that's the first step in the right direction.
All right. Thank you so much, Dr. Kubiat, for coming on the show and giving us some wonderful insights on
interesting.
Yeah, quite interesting. But before you go, could you give us a closing remark and perhaps you talk more on stigma? Because I know it's a major thing. That stigma thing in our society, it seems to be a major problem. Even though one of the tweets said that's actually not the major problem. The major problem, according to the Twitter, was seeking help.
Yes, but
the
not
access
stigma.
to help is another major problem. But let's just give us your closing remarks with all this in mind.
All right. To close, I would like to say that with any illness at all, stigma is common. It's something that plagues any kind of illness. So it's best to be empathetic. Show empathy to anybody that you suspect may be having any form of mental distress or even a mental illness. For people that are living with persons that have been diagnosed of any mental illness at all, understand that it's not an easy road. You would have to support this person, because when you have good support, there's a good chance of recovery, and then always tilt in the direction of professional help. Yes, there's no need to be in denial. There's no need to load yourself, self-loading or think you're a failure, based on how our culture perceives these things. And importantly, World Mental Health Day is on the 10th of October. We in the Department of Mental Health will be doing mental health screens, mental health education, awareness at the Primary Healthcare Center, Barracks Road. And on Friday, there will be an outreach at the department to give free consultations and treatments to any persons that may be suffering from these illnesses.
Nice work you guys are doing there. Thank you so much for coming on the show.
Thank you for having me. Thank you so much.
Well done. Take our greetings back to you, the people in the department.
And our prayers back to the ones who are yet to recover.
Exactly. They will.
All right, to our audience, thank you so much for tuning in and joining the conversation. Remember to prioritize your mental health and seek help when needed. So until next time, from all of us here is take care of yourself and each other. Bye-bye.
Bye.